What do you call the term that is used to indicate the number of antibodies present in a blood sample? Anybody? Yeah. Titers.
I mean, close enough.
I've heard it called titers, I've heard it called teeters, but it's the first time.
Titters.
Okay. It's going downhill. Yeah. Okay. So.
I wish Aubrey was here.
Okay. So what do you call a person who is colonized but not ill? A carrier. Yeah, carrier. Oh, God. Okay.
It's been on my mind recently.
How is hepatitis B spread? How is hepatitis B spread?
Blood?
Blood and?
Bodily fluids.
Blood and body fluids, yeah. Okay. An OSHA-approved respiratory mask is required for use by healthcare workers at high risk of being exposed to which of the following? And no, COVID is not in here. Hep B, Hep C, MRSA, and TB. TB, yeah. If COVID was in there, that would be an answer too. What's yeast?
Fungus.
It's a fungus. That's correct. Yeast is a fungus. Okay, so on that subject, I've got 4 diseases here. So fungi, prions, protozoa, and bacteria. Which of those 4 cause TB, strep throat, and necrotizing fasciitis? Bacteria, yeah. We've been talking a lot about nosocomial infections. What does that mean? Hospital or healthcare, yeah. Not necessarily just hospital. Usually come out of nursing homes and places like that. Okay. Oh. HAI, which is hospital-acquired infections, are now called nosocomial, yeah. The complete source of information about infectious diseases in the US comes from the CDC, WHO, OSHA, MRSA. Yeah, obviously not that one. Pardon? That's the CDC, yeah.
What was the question again?
Pardon?
What was the question again?
The most complete source of information about infectious diseases
Okay.
in the US. Okay. Oh, okay. Just bear with me here. My mucocutaneous candida, disseminated herpes, cytomegalovirus, and pneumocystis carni, pneumonia, are all examples of HAI, multi-drug resistant infections, airborne diseases, or opportunistic infections associated with AIDS.
Opportunistic
What are these?
infections.
Yeah.
Associated
opportunistic infections of AIDS or HIV. Yeah. So I think we discussed this, but I'm going to discuss it again. When we are treating a patient with something like MRSA or shingles or whatever it happens to be that requires us to use gloves and maybe a gown, but usually it's just gloves. Sorry, nose is itchy. We have a clean therapist and a dirty therapist. What does the dirty therapist touch? Only
The patient?
the patient. They don't touch the machine, the bed, or anything else. They're purely there to move the patient. What government agency oversees job safety and health protection of workers? CDC, DEA, Joint Commission, or OSHA?
OSHA.
OSHA. Concept known as universal precautions. It's best applied to all body fluids, all patients, all blood and certain fluids in the patients, or all patients and all body fluids.
All patients, all body fluids.
Yeah, okay. Alcohol-based hand rubs. Stuff that we've been using in our hands for the last year, are indicated for all of the following clinical situations except preoperative cleaning of hands by surgical personnel, after removing gloves, before inserting urinary catheters, intravascular catheters, or other invasive devices, or when hands are visibly soiled.
When hands are visibly soiled.
Right. Okay, I've got a number of, just to give you a break, a number of true or false ones. Epidemiology is a name for medical science field that studies the incidence, distribution, and determinants of disease. True. Fingernails are the primary reservoir of microflora on the hands even after intense washing.
True.
While gloves should be always removed before answering the phone or operating the console, it is okay to operate the couch controls with your gloves on, since you will wipe it down with alcohol wipes between patients anyway. False. That's correct. Yeah. You do not touch the hand controls with gloves on. When administering an ink tattoo, you can reuse the same ink syringe as long as the needle is changed. True or false? This will be a guess for you guys, but I'll explain it later.
True, because the needle is changed.
False.
Okay, never mind.
Yeah.
Can you change the needle on it though, or no?
Pardon? You can change the needle, yeah.
Oh.
It really does depend a lot on, most people don't use a syringe. Most people use a drop of ink, and then the needle goes into the drop of ink and then onto the patient. That's how it's usually done. And then you get rid of that needle, pick up another one and do the next tattoo. You should never use the same needle for multiple tattoos. However, you may find that happening in the clinic.
Infection.
Please don't yell at them.
Textbook answer is no.
Pardon?
But the textbook answer is no.
Yeah. Well, if that's their policy, then there's nothing we can do about that. And there's nothing you should do about that. Just make a note, and tell me about it. Whether they'll do anything for me, I don't know, but, you know.
Can I get myself a tattoo?
Bolus can be used,
I'll fix my tattoo.
bolus can be used on multiple patients as long as it's cleaned with alcohol wipes between use. False. Kind of, yeah. Well, normally what we do is we cover it in basically saran wrap. Now, if you cleaned it with alcohol, then you could probably use it for multiple patients. But it'd have to be cleaned very, very well. So officially it's true, but it's probably not acceptable. So officially it's true.
But false.
What I
So
would
should
do
we-
is cover it in saran wrap first.
So for the test,
Sorry?
for the test, what's the answer?
It is true.
True?
For
Okay.
the test, it is true, as long as it's well, because you're cleaning it with alcohol, so it's clean. Okay, 4 items here. Select the organ most commonly used by the body to excrete drugs and their byproducts. Kidneys, lungs, sweat glands, or all of the above.
Oh wait, you said wrong.
Most commonly used.
Kidney.
Kidneys, thank you. Next one. So I have light rash, hives, nausea, or cardiac or respiratory arrest. Select the most serious allergic reaction to a drug. Yeah, that's about the most serious thing, yeah. Okay. What's the first duty of a therapist if a patient has an adverse reaction to a drug? Now, we're not saying that he's going into cardiac arrest, he's just having an adverse reaction. Could be something as simple as hives. Okay. The first duty of a therapist: locate emergency supplies, begin CPR, call a code, or observe the patient carefully.
Observe?
Pardon?
It's either A or D.
Yeah,
So observe the patient carefully?
probably. That seems right.
Yeah,
Then you can figure out what medical
yeah, because,
thing
I
to
mean,
take next.
it could be something as simple as, oh, I'm itchy, or I have some hives. That's a very mild reaction. But you should be aware of that, keep an eye on the patient, and make sure that you know where the stuff is in case it gets more serious. There should be a physician in the area whenever you're giving contrast to a patient. So which of the following drugs may be given to relieve anxiety? So there's a choice. You can have, there's 4 of them, and you can make a choice as to which ones you might choose to relieve anxiety. So there's Ativan, Valium, Librium, and Prozac. Which ones would you choose? Pardon?
What is that L word you said?
Librium,
I've not heard of that, but I've heard of the other three.
okay.
I say Valium.
What?
I've heard Valium a lot.
Yeah,
Valium, Ativan, and
so you have a choice of 1, 2, 3, and 4, or a combination of all of them.
1, 2, and 4.
1, 2, and 4. Anybody get any?
I don't remember them all.
It's
Ativan,
Valium, Ativan, and Prozac.
Ativan, Valium, Librium, and Prozac.
I feel like
Ativan, Valium.
2 of those are slow for like long-term slow release if you're looking for something. Are we talking about like they're having a panic attack right now?
No, doesn't say, this is all it says, select the drugs that may be prescribed to relieve anxiety.
Oh, okay.
It doesn't say you need to give them an
Ativan.
Ativan immediately.
Definitely the
It
last
could
is-
be that they're coming in tomorrow for an MRI and they don't like MRIs and they're gonna freak out, so give them something.
Valium, Ativan.
And
Another one.
Librium.
Librium.
Librium is in the same group as
So 1,
Valium.
2, and 3.
Pardon?
So 1, 2, and 3.
1, 2, and 3.
How do you spell Librium?
Librium. Which part of the body is barium sulfate used as a contrast agent? Gastrointestinal, yeah. Okay, so we've got 4 options again. State potential reasons why a patient may be unable to take oral preparations of a drug. Patient is experiencing nausea and vomiting. The patient has difficulty in swallowing. The patient refuses to swallow medication. Or all of the above.
All the above.
Yes. Okay. What does BID stand for?
Twice a day.
Say again?
Twice a day.
Twice a day. Intrathecal administration means the medications are injected directly into which part of the body? Is it the brain, the spinal canal, the bone joint, or urinary bladder? Intrathecal. Intrathecal. No? Anybody care to guess?
What are the
Bladder.
options again? I'm sorry, spine, bladder.
Brain, spinal canal, bone, the joint of the bone, or urinary bladder?
Bladder.
Spinal.
Spinal is my guess.
Spinal, yeah, spinal canal. Yeah, intrathecal means spinal canal. They actually put chemotherapy into via intrathecal. Which of the following radioactive isotopes is used in radiation therapy? As a rule, not nuke med, not as a tracer for nuclear medicine, but actually in radiation therapy. Strontium 89, technetium 99, fluorine 18, hydrogen 3. Anybody? Anybody want to take a guess?
Strong.
Strontium 89. There are two strontiums, you have to be careful which one you use.
I just remember the
Strontium.
other ones were diagnosed.
Strontium 89, it's used for bony metastasis from prostate. Not used very often, but it is used. Opioid medications are prescribed for what purpose? Pain control, yeah. The name given to a medication by the manufacturer is called its what name? So trade, brand, generic, or chemical?
Chemical.
Chemical?
Oh, will it
Manufacturer.
would it be the generic? The chemical is like the,
It's a trade name.
okay.
So, Motrin, or Advil, or aspirin, those are all trade names.
Yeah, I was
Given
thinking
by-
like who actually made it. Like,
So the generic name is, ibuprofen, Tylenol 3, that type of thing. Okay. Type of drug given to cancer patients to relieve nausea and vomiting is what? Antiemetic, yeah. What does QOD stand for?
4 times a day?
Say again?
Every other day?
Every other
Oh,
day.
I don't know. I
Yeah.
always say
QD is daily. QOD is every other day. Which of the, what drug category would you put Imodium in? Antidiarrheal, right. What drug would be given to a patient who needs a blood thinner? So we have Dilantin, Decadron, heparin, and Zoloft. Heparin, yeah. Not that that one's used much anymore, but. The escape of fluid from a vessel into the surrounding tissue, which can cause localized vasoconstriction, is termed, and I'll read them out to you. Everybody know what I'm, okay. Anaphylaxis, extravasation, edema, and hematoma. Pardon? Edema, no. So if you're putting the drug into the vein and miss, and the drug continues into the tissue around it,
It'll swell up.
pardon?
Wouldn't it swell up?
It's called extravasation. So it's going into the tissue around the vein rather than into the vein. It may cause a little bit of edema, but that's not what it's actually called. Narcan is given to
Overdose.
Yes, dear. It is being given to correct an overdose of opiates.
You should have asked what the drug was
Yes.
instead of
Mhm.
saying Narcan first.
I won't even, I should put in its correct name, not Narcan. Okay, common medication is classed as both a tranquilizer and an anticonvulsant. Is, and I'll give you them, meperidine, diphenhydramine, betadine, and diazepam. Diazepam. Don't tell me that's the only one you recognise, right?
Yeah.
Good one. Yeah, okay.
You got.
Okay, well, whatever works. Okay. Adrenaline is a trade name for which of the following? Dopamine, epinephrine, ephedrine, caffeine. Epinephrine, yeah. Which of the following emergencies is a therapist least likely to encounter? An asthma attack, pulmonary edema, choking, or cardiac arrest?
Choking?
Least likely?
I don't know what they would be choking on.
I choke on my spit, so.
That is true.
We've already
Well,
learned
That's
that.
incorrect.
Yeah,
She
he
said
wants to.
she chokes on her spit, so
Well, that's true, yeah.
So.
I guess they're all on the
Your
table.
teeth are
I'm out.
fine.
Pulmonary edema, usually, because a lot of people have, pardon?
How often do you have people choking?
Really? That's so
We have a fair number.
What if you're treating your throat and I just feel like they're gonna choke and then
Yeah.
I just start choking?
If
Yeah, but I don't think they're
you
actually
are lying
choking.
with, to be honest, if you're lying with a mask on and you have difficulty swallowing, it may feel like you're choking. And there's a lot of people who have that problem, so.
Or if you end up really, really, really big when you're older, your titties will choke you too.
Okay. An allergic reaction.
Oh, a way nigger? Okay.
Okay. An allergic reaction to the administration of certain drugs may cause urticaria. What is urticaria? Urticaria, guys, what is it?
How is it spelled? Urticaria. Oh,
You are?
urticaria.
Urticaria. Urticaria.
Something in the urine.
No,
What was the question?
an allergic reaction to the administration of certain drugs may cause urticaria.
Hives?
Yeah, hives. Oh. Nothing to do with urine. Sorry, good thought, but nothing to do with urine. Okay. Drugs in the anesthetic category are intended to suppress which of the following? Muscle spasms, allergic response, sensation of feelings, or blood pressure.
Sensation of feelings.
Sensation of feeling, yeah. Medications used to regulate blood glucose levels include insulin and metformin. These medications are classified as antiarrhythmic, anticonvulsants, analgesics, or hypoglycemics. Hypoglycemics, yeah. What type of drug is used to treat edema?
Lasix, like an antidiuretic.
It's actually a diuretic, not an antidiuretic.
Sorry.
That's okay. No, it's a diuretic. You're trying to get rid of the edema is fluid. You're trying to get rid of the fluid, therefore you're using a diuretic. Which of the following are chemotherapeutic agents? Antifungal, radioactive isotopes, antineoplastic drugs, or none of the above? Hmm?
Did you say anti-plastics?
Anti-neoplastic. Is that it?
I don't know. I think.
It is.
Okay.
Anti-neoplastic drugs are basically chemo drugs. Neoplasms are cancers, or tumors actually. Neoplasms are tumors. Therefore, anything that causes a reaction are anti-neoplastic. That makes sense?
Yes.
Okay. You did good, guys.
That was fun.
Tell me about it next week.
Oh, okay.
So, questions on either the stuff we did this morning or the stuff we did this afternoon? I will be sending out a list of the PowerPoints that we looked at for both CNS and PEDS. Any questions on either of those?
Do you have our, patient care midterm? Alright,
Okay, let me give it to you then. Okay.
I don't know what